Well, good afternoon, everybody. For those of you who don't know me, I am Ellen McKenzie, Dean of the School of Public Health, and this is my first Dean's Lecture, which I am thrilled to welcome you all to. As many of you know, who have been to a number of Dean's Lectures over the years, the Dean's Lecture series was designed to introduce the community to the work of newly promoted or appointed full professors to the School of Public Health and providing a forum to encourage and promote the interchange of ideas among our faculty. Now, being the new dean, I asked Becky to actually search the archives. And I said, so how long have we been doing this? Who set it up? And there is actually a folder with lots of little fun tidbits. And what we found was that it seems like the Dean's Lecture Series was established by D.A. Henderson when he was dean. And the first one was given around 1980, 1981. And we couldn't find the program for the very, very first Dean's Lecture, but we found the second one, and it was given by Moises Sklo. And the title of his Dean's Lecture was The Epidemiologic Basis of Prevention, How Much Data Do We Need? So I thought that was a rather provocative title for someone like Moises Sklo. Clearly, earning the rank of full professor at the Bloomberg School represents an incredible achievement and confirms not only the respect and high regard of the school for the professor, but very importantly, of colleagues across the nation and throughout the world. And I can think of no better way to kick off this series, for this year, series of Dean's Lectures, than by introducing you to Professor Elizabeth Letourneau. Elizabeth was recruited to the Bloomberg School in 2011 as an associate professor in the Department of Mental Health and became the inaugural director of the Moore Center for the Prevention of Child Sexual Abuse. She was promoted to full professor in 2016. So you can see we're a little bit behind. We've got a roster of about 20 full professors that we need to celebrate. We talked about how we're going to get through that list, and someone made the suggestion, well, maybe we should stop promoting any new professors, just put a halt to it so that we can get through. But that didn't meet with a lot of enthusiasm. So Elizabeth was promoted in 2016. Before coming to Hopkins, she served on the faculty of the Medical University of South Carolina for 11 years, where she also completed an internship and a postdoctoral fellowship at the university's National Crime Victims Research and Treatment Center. Elizabeth received her bachelor's degree in psychology from the State University of New York and both her MA and her doctoral degrees in clinical psychology from Northern Illinois University. Elizabeth's research, which you'll hear about today, focuses at the intersection of prevention of child sexual abuse victimization and perpetration. She has conducted research on the evaluation of sex offender public policy efforts, development and evaluation of the assessment instruments and clinical interventions, addressing youth and adult sex offending behaviors, and has also developed and evaluated interventions addressing youth sexual risk behaviors. She has garnered support for her work from NIH, from CDC, from the National Institute on Justice, and several private foundations. Her policy research findings have been cited in state Supreme Court cases, in federal and state criminal court cases, and by state legislatures in support of revising juvenile sex offender registration laws. This and other translational work of Elizabeth's was recognized by the school, which awarded her the first Faculty Practice Award. Elizabeth's prevention research has garnered international attention, and she now serves as co-chair of a new committee on child sexual abuse prevention supported by the Vatican. I remember being at a meeting with Stephen Moore, whose very generous gift to the school helped support the start of the Moore Center. And he got a text from Elizabeth, and it showed a picture of her meeting the Pope. And Steve was so excited and said, see, Elizabeth has garnered the attention of the Pope. And he was just so excited, and he's just so pleased with what Elizabeth has done in her own right, but also in developing and leading the Moore Center. He couldn't be prouder. Closer to home, Elizabeth's work has been widely reported in high-impact media, including the American Life, TED-Med, PBS NewsHour, NPR's On Point, Psychology Today, and The New Yorker. She is a member of the Maryland State Council on Child Abuse and Neglect and is a past president of the Association for the Treatment of Sexual Abusers. In addition to all of this, to her contributions to research, practice, and policy, Elizabeth has been recognized for her excellence in teaching and student mentoring. She exemplifies the triple threat that we all look for in our professors. Please join me in welcoming Professor Elizabeth Letourneau.
Thank you, Dean McKenzie, for your kind words, and also for leading the way here at our school. It's a joy and an honor to present this Dean's Lecture. Before I get started, I want to acknowledge my chair, Danny Fallon, whose support has been just instrumental in the success of our center. I want to acknowledge our center's benefactors, Steve and Julia Moore, and I want to thank the wonderful, wonderful people that I work with at the Moore Center and in the Department of Mental Health, people who make every day enjoyable and exciting. The person I'm most thankful for and most grateful for is my husband, Robert Bush, who's here with my children, Emmett, who's 9, and Garrett, who's just about to turn 14. Hi. Bobby's childhood was tragic. He was raised by substance-abusing parents who divorced before he was born. He was subjected to harsh physical punishment and constant belittlement by his alcoholic father, who retained custody. And he was physically and sexually assaulted by his mother's second husband. There were a few bright spots. Against all odds, Bobby was born at full term, met typical developmental milestones, and achieved good grades in elementary school. Bobby's father maintained regular employment, and his second wife was kind to Bobby, although ineffective at parenting or protecting him due to her own mental health issues. Children, of course, require more than 1 in 4 adults to be loving or at least non-abusive if they're to thrive, and so Bobby did not thrive. Having no good models for emotional regulation, he failed to learn to regulate his own emotions. Having too many models for verbal and physical aggression, he became verbally and physically aggressive. And having been sexually victimized, he learned to use sex as a weapon. At the age of 9, Bobby initiated an inappropriate and harmful sexual relationship with a younger relative, a 5-year-old boy towards whom Bobby's father demonstrated love and tenderness. It baffled Bobby watching his father, who had never shown anything but disdain for Bobby, to behave so differently, so nicely to this younger boy, and it made Bobby want to hurt him, to punish him for usurping the parental affection that was by rights Bobby's. The younger boy was medically fragile, and his older siblings were punished severely when they treated him too roughly. So instead of hitting the younger boy, Bobby sexually abused him, made the younger boy give him oral sex. Bobby was 9. He could not possibly have understood the consequences of this behavior, apart from having some foggy notion, based on his own victimization, that this would hurt the younger boy. Bobby kept this up for 3 years, and the younger boy stayed silent. Meanwhile, Bobby's behavior deteriorated at school. After threatening to kill a classmate, Bobby picked up his first juvenile offense for disturbing schools and was placed on probation. He was 11 years old. And he began lashing out at his father. As a result of one particularly violent episode, Bobby was placed in a residential treatment facility to address his aggressive behavior. While at the facility, an older boy tried to rape Bobby, and when Bobby went home and a weekend passed, he raped his younger sibling, or his younger relative, rather. And after a few of these exponentially more horrific episodes, the younger boy finally broke his silence and told Bobby's stepmother about the abuse. When confronted by his stepmother, Bobby confessed immediately, and he wrote a letter apologizing, saying he knew his actions were wrong and that he was glad it was over, that he hoped his younger relative would be okay. But no one in this story is okay. Bobby's stepmother knew Bobby needed help, but she didn't know where to find it. So she called the police. She showed them Bobby's letter, and the prosecutor assigned to the case used that letter, that confession, to convict Bobby on the harshest charge possible, criminal sexual conduct with a minor in the first degree. And the judge sentenced Bobby to prison for the longest term possible, 5 years. He was 13 years old when he arrived, and 18 years old when his prison sentence ended. And in the intervening years, Bobby reinvented himself. Away from his abusive father, Bobby learned something about self-control. His brain continued to mature as young brains will, and he developed his capacities for empathy, understanding, delay of gratification. The prison social worker attested to his improved behavior. A review of records showed declines in disciplinary infractions as the years progressed. And specialized risk assessment procedures documented that Bobby was attracted to young women, not to little boys. Prison is no place to raise a child, but prison is where Bobby found himself. And he ultimately made the best of it, completing sex offender therapy, earning his GED, and picking up some vocational skills. And when it came time for release, Bobby had the backing of those adults who comprised his constricted world. But this was not to be the end for Bobby, or the beginning, depending on your point of view. Bobby was not released from incarceration after spending 5 formative years in prison. The state where Bobby resided is one of 20 states that operate sex offender civil commitment facilities. These facilities are designed to indefinitely hold and treat adult sex offenders who are determined too dangerous for release back into the community at the end of their prison sentences. Sex offender civil commitment was designed for men like Earl Schreiner. While incarcerated for earlier sexual assaults against numerous children in the 1980s, Mr. Schreiner promised that if he was ever released from prison, he would continue abusing children. He was released, and he made good on that promise with the sexual mutilation of a young boy whom he left for dead in the woods. Sex offender civil commitment was never intended for minors, for people who committed their sexual offenses as children before the age of 18. Certainly not for people who committed their first offenses at the ages of 9, 10, 11, or 12. And yet Bobby's state decided, against all credible evidence, that he presented a threat similar to that of Mr. Schreiner, and they fought to put him away in a high-security sex offender civil commitment facility, a facility whose own director went on record to say that Bobby did not belong there, that Bobby was inappropriate for that facility and would be endangered by the more truly dangerous men already housed there. These pleas fell on deaf ears, and Bobby was committed. The facility director supported Bobby's annual efforts to secure release. Each year, Bobby's lawyers would request his release. Each year, the state would deny release, and a jury trial would ensue. Jurists never deigned to release Bobby from civil commitment. Finally, Bobby's lawyers won his release through a state Supreme Court challenge. He was 22 years old. And that's the end of what I know about Bobby, except that no matter where he lives, whether in the state that incarcerated him or any other state, he will be subjected to lifetime sex offender registration and public notification. Every 3 months, he will have to present himself at a sheriff's office or a law enforcement facility to have his picture taken and posted on a public sex offender registry, along with his home address, his work address, and up to 70 other pieces of information. There are hundreds of scientific publications demonstrating that incarcerating children does nothing to improve community safety. and indeed can increase a child's risk for committing new offenses. There are dozens of scientific publications, many of them my own, demonstrating that subjecting children to registration and notification does nothing to improve community safety. Our latest study links juvenile sex offender registration and notification to increased risk for child suicide attempts and to increased risk for sexual victimization, the very type of harm registration was designed to prevent. Some people may think that's fine, may believe that anyone who sexually abuses a child deserves a decade or more in confinement, a lifetime of public shaming on the registry. Some people may not care that these interventions don't actually improve community safety so long as they punish sex offenders. But for a child, does any of this make sense for a child? For any child, but particularly one whose behaviors were so clearly tied to his own victimization. Some people think yes, even for that child, that regardless of age or experience, these people get what they deserve. In that case, we ask, does cost matter? Because there are some serious costs associated with the state's decision to wait for harm to occur before intervening. Based on public records, Bobby's year of residential treatment cost approximately $90,000. His 5 years in prison cost $250,000, and his 5 years in sex offender civil commitment cost $315,000. And then there are the costs associated with the initial prosecution for his school offense, prosecution for his sexual offenses, the 4 jury trials, the state Supreme Court case, and a lifetime of sex offender registration. Collectively and very conservatively, this state invested more than $700,000 in Bobby. And none of that money made a bit of difference to Bobby's victim. How much money do you suppose that state invested in prevention efforts? In Bobby's records, to which I had access as an expert witness at one of his trials, I found little evidence that he or his parents were ever provided with effective prevention or treatment programs. Yet there are programs that work, many that work to prevent at-risk parents, like Bobby's, from physically abusing, psychologically abusing, or neglecting their children, programs such as nurse-family partnerships. Likewise, there are several well-validated early intervention programs that effectively address a child's disruptive behaviors, programs like the Incredible Years. And there are well-validated treatment programs that effectively address a teenager's serious delinquent behavior, including harmful sexual behavior, such as multisystemic therapy. I ran the largest randomized clinical trial of multisystemic therapy, demonstrating that it effectively reduces risky and delinquent sexual behavior among adolescents with sex crime charges or adjudications. Had the state elected to provide these or similar prevention and early intervention programs to Bobby and his parents, the total bill would have amounted to less than $25,000. That's 28 times less than the state ultimately paid out. And Bobby might never have sexually assaulted his younger relative, or the abuse might have been discovered and addressed before it progressed to rape. Designating massive resources after sexual abuse has already occurred, and almost no resources to prevent abuse, is a choice. Children are harmed by this choice. We are harmed by this choice. So why do we do this? Why do we put nearly all our money, time, and effort into punishment? I believe that we focus so much energy on after-the-fact responses because most people don't really believe that child sexual abuse can be prevented. Instead, we believe that people who sexually abuse children are monsters, that they are the ultimate other, and the best we can do is to keep them out or lock them up, no matter what the cost. We believe that people who commit sex crimes are on an irreversible trajectory towards more offending and towards greater harm. We believe they are all Earl Shriners. This is simply not true. It may surprise you to learn that about half of sexual offenses committed against children are committed by other children, under the age of 18, and often under the age of 15. Hundreds of research studies, including my own, find that the vast majority of these children will not go on to commit another sexual offense. 97% of children with a sexual offense conviction do not get a second sexual offense conviction. Clearly, these children are not on an irreversible trajectory towards more or worse offending. Moreover, the fact that so few of them reoffend with a new sex crime suggests that we probably could have prevented the first sex crime in many, perhaps most of these cases. We know that children act out sexually for a number of reasons, including ignorance, impulsivity, inadequate adult supervision, exposure to harmful role models, to developmentally inappropriate sexual stimuli, to sexual and physical assault victimization. Developing, evaluating, and disseminating effective programs to prevent adolescent sexual assault perpetration from occurring in the first place should be a national priority on par with prosecuting and punishing children after they've already engaged in harmful behavior. To build a comprehensive approach to child sexual abuse, an approach that includes effective prevention efforts requires resources. Elected officials tell me time and again that they agree it would be better to prevent child sexual abuse, that no child should have to experience sexual abuse, and that they understand that prevention is probably more cost-effective than after-the-fact intervention, but they just don't have the money. Yet they have the money to invest $700,000 in Bobby. My colleagues and I recently published an economic evaluation of child sexual abuse. We estimated the annual economic burden of child sexual abuse to the United States is more than $9 billion. We have the money. We have the money to fund prevention science in this area. We just choose to put it elsewhere. Convincing policymakers that child sexual abuse is preventable, not inevitable, is a fundamental and necessary first step to convincing them to fund prevention efforts. When I mention child sexual abuse prevention efforts, people often tell me they have a difficult time envisioning what I mean. So I want to take a step back for a moment and look at prevention in other areas. At Hopkins, public health scientists improved the polio vaccine, pioneered the use of latex gloves by surgeons, and invented the child safety car seat. Each of these prevention tools, the vaccine, the gloves, the car seats, seems easy and obvious today, but each required resources, time, and effort to develop, and each one met with some resistance. I'm one of 5 siblings. There's me, there's 3 boys, and there's my baby sister who's 23 years younger than I am. Same parents, same crazy, insane parents. By the time Jenny came along, car seats were the law of the land, and my mom hated them. And she was 100% convinced that Jenny would fuss less, would cry less, if we would just let her roam around in the car, like we had all been allowed to do, and on occasion bang around in the car. No one feels that way anymore. We readily accept vaccines. We would never let anyone operate on us without gloves. We all use car seats. I think the prevention of child sexual abuse could look like this in 5 or 10 years. that we could develop interventions that by the time they've been tested and disseminated seem easy and obvious. And that's the mission of the Moore Center. For the remainder of this presentation, I'm going to describe some of the prevention efforts that my colleagues and I are working on at the Moore Center as we seek to implement our vision of a world without child sexual abuse. The first of these is responsible behavior with younger children, a universal school-based prevention program that targets 6th and 7th graders with messaging, information, and tools to avoid engaging younger children in sexual behavior. I'm collaborating on this project with my colleagues Cindy Schaefer and Catherine Bradshaw, and with the support of a small grant from the National Institutes of Health. And I want to ask a question, and this is an audience participation thing here. How many of you have ever told an older child to not hit or kick or punch or tease a younger child? Hands up high. Almost every single person in this room. The people not raising their hands are the ones that I tell that to every single day. Every single day. Don't hit your brother. Why? He's smaller. It's not rocket science. How many of you told that same older child not to touch the penis or vagina of the younger child? Danny, yay! A couple of you, yay! But not very many of us. We have a hard time talking to our kids that directly, and a lot of people, I think, just assume 10 and 11 and 12 and 13-year-old kids will intuit somehow that younger kids are off limits, even though they're just starting out in their sexuality and they don't know nothing about it. They certainly don't know that younger kids are off limits. This is not an especially effective strategy, right? So responsible behavior with younger children involves going into 6th and 7th grade classes, into the health classes, and addressing some core concepts. But at its heart, it's really about really clear messaging, using those words, don't touch penises and vaginas of younger kids. It is not rocket science. So that's one of our interventions. And we also pull in parents with kid-led activities. So we never just rely on kids to keep themselves safe. The second prevention project that I want to mention is called our Help Wanted Prevention Project, which we've been working on now for several years. We're developing an online intervention for people who have unwanted sexual interest in children. We're targeting young people for whom there are almost literally no resources available whatsoever. There's a lot of collaborators on this project, and we have some funding from Reliance, which is a new sexual violence prevention foundation funded by the NFL. We started this project with a qualitative study where we asked young adults living in their communities who self-identified as being sexually interested in children but not acting on that interest, what would have helped them when they were younger, when they were adolescents. And from those interviews, we've built our first 5 core modules. We're working with a company called 3C Institute to place these online in an engaging and interactive way. Because of mandatory reporting laws, we can't in real time interact with people who have sexual interest in children because we might be forced to report their behavior to the authorities. So we're developing this as a self-help sort of a la carte intervention. This particular program, our Help Wanted, has garnered a lot of media. Dean McKenzie mentioned some of it, an award-winning podcast on This American Life called Help Wanted, a long-form article in The New Yorker, and another long-form article in Matter.com, and a TED Med talk that I gave in late 2016. The third prevention program that I want to mention is one we call Parent Props, or Promoting Positive Sexual Development. This is a brief 4-session prevention intervention designed to give parents communication tools and other skills and knowledge that promotes positive, healthy sexual development of children, and also, we hope, promotes avoiding unhealthy sexual behaviors. We are, my colleague in the Department of Mental Health, Tamar Mendelson, is a co-lead on this project, and we're partnering with a local child advocacy center, the Baltimore Child Abuse Center, as well as other child advocacy centers in Maryland and in Pennsylvania. We're working with child advocacy centers because that's the place where children who are suspected of having been victimized get evaluated. And we believe that those parents will find healthy sexual development a particularly salient topic, and we might be able to engage them in some prevention programming. Some of the core concepts that we'll address, again, really trying to provide some clear communication strategies for parents as they talk with their kids about healthy as well as unhealthy sexual behaviors, and some other core concepts. In addition to child and family and school-focused prevention interventions, we're also working with larger organizations to prevent institutional child sexual abuse. The Larry Nassar case painfully demonstrates that institutions still do not know how to prevent child sexual abuse and still don't know what to do when it happens. We have a grant under review right now that, if funded, will allow us to collaborate with the Boys and Girls Clubs of America, Big Brothers Big Sisters of America, 4-H, and the Y. At the national level, these organizations collectively serve more than 20 million children each year through more than 2 million adult staff and volunteers. We want to work with them to identify what they're already doing to prevent child sexual abuse and to maximize those efforts. We have another grant poised for funding, poised, but not yet, by the NIH, that would permit us, if funded, to collaborate with the largest child abuse prevention and intervention institutions in the United States. These include the National Children's Alliance, the American Professional Society on the Abuse of Children, and Prevent Child Abuse America. Those three organizations provide prevention and intervention services at thousands of sites across the United States. We want to harness their power to improve how their frontline providers communicate with the public about child sexual abuse. Again, to communicate that this is preventable, that we don't have to wait for it to occur. And we are collaborating with the church, with the Center for Child Protection at the Pontifical University Gregoriana, a university that's been in operation since the 1500s and is the Vatican's Child Sexual Abuse Center. The church has played a large role in the abuse of children. They are starting to play a role in its prevention, and we're partnering with them to make sure that we all get this right. Responsible behavior for younger children, with younger children, Help Wanted, Parent Props, and our work with youth-serving organizations and others. Those are just a few examples of what child sexual abuse prevention might look like. Ultimately, we want to convince the public that child sexual abuse is preventable, not inevitable. And we want to convince policymakers that funding this prevention science is worthwhile. Ultimately, we want to ensure that resources go upstream so that children like Bobby and like my own receive what they need before harm occurs. Ultimately, we envision a world without child sexual abuse. Thank you.
So we do have a few minutes for questions, and I think we have microphones here. So you come up and, because we're recording this session, and here I am talking without a microphone. But please, or we can hand your microphone.
Thanks, Elizabeth, for a great talk.
Thanks, Maria.
Has anyone looked at the role of privately run prisons and what's called the prison industrial complex in sort of creating and sort of perverse incentives for spending so much money on, incarceration and commitment and things like that?
So the question was, has anyone looked at the role that the private prison industry might play in incentivizing our use of coercive tactics like very lengthy sentences? And indeed, I believe there is research in that. It's not my area of research. There is a movement afoot, spearheaded by the anti-EKC Foundation to close youth prisons, to close all youth prisons. And they actually have achieved that goal in a few states, and they're moving forward in many other states. Their work did identify that having large facilities that are built and that exist to incarcerate children does, in fact, seem to play a role for states to keep them filled so that you can maintain those jobs. So there are some concerns. However, states like the rest of us all become more cost conscious. And the research is irrefutable that prison doesn't work and that it is incredibly expensive relative to effective treatment programming. So even in Republican-led red states, there are states, Missouri is one of those, that have closed their youth prisons. Yeah.
Elizabeth, what is the role of the clinical professions? Are there interventions that work that are pediatrician-targeted interventions or other medical professionals?
Yeah, there are. The role for the medical profession is a strong one. The World Health Organization just released guidelines recommending how to address suspected child sexual abuse by frontline providers, and specifically pediatricians, general practitioners, and emergency department providers. It was targeted towards low and middle income countries, but the recommendations apply to everywhere. Tackling this head on is really important. Howard Dubowitz is a pediatrician at the University of Maryland, and he developed and evaluated a prevention intervention for physicians. It's called SEEK. I can't remember what, something every child, safe environment for every kid, SEEK. And what they found is that when pediatricians just ask parents who bring the kids in, ask them about physical, sexual abuse, neglect, that process in and of itself appears to be associated with prevention. And not in the sense that parents then just hide those answers or lie or don't come back, but actually just alerting parents to these concerns at an early age of their children can have a preventative effect. Sure.
Elizabeth, that was absolutely gripping, the way you tell your tale. So my question goes to the contrast of the story you told of Bobby and the factoid you inserted in the middle of I think it was 90% of children do not have a second offense, which is quite different from the tale you were telling. What's either the understanding or the evidence for why there isn't a second? Is it because the first was just so specifically circumstantial, or that interventions have worked, or is it very multifaceted?
Sure. Let me first say that Bobby actually is an example of someone who hasn't had a second offense, in the sense of once somebody has been adjudicated, they don't have a second offense. So the process of being caught, and we don't know if you have to be caught legally or just the process of being caught at all as a kid, is enough to convey the information, this is wrong. So we know from our treatment research, actually, my colleagues and I know, that one of the leading risk factors for engaging in inappropriate behavior is not having enough knowledge about what's okay and what's not okay to do sexually as you become sexually active. So a lack of knowledge disappears when you get arrested for the behavior. Now you know to your core that this was wrong. You've been punished for it, sometimes very, very severely. But it gives you the information that this was wrong. So that may be an intervention all by itself. But also, kids engage in lots of inappropriate behavior that they mature out of in a natural way. That includes all kinds of delinquent behavior, and that includes sexually delinquent behavior. This is not somehow different from other misbehavior that children engage in. It doesn't set them apart as sexual monsters or on this path. It is very much like other behavior where they didn't know it was wrong, or they knew it was wrong but they didn't know how wrong it was, or they just didn't have enough control over their own impulses, or like I said, inadequate adult supervision is really key. And that's really important at a time of early adolescence and adolescence. That's right when we want to start giving our kids more freedom, and we should. But we have to give them that freedom with structure that tells them, where are the boundaries that you can't cross, And again, 3 people held up their hands when I said, have you told an older kid not to touch the penis or vagina of a younger kid? So we don't give them that information when it comes to sexual behavior. Lawrence Steinberg has a wonderful book called Adolescence, Age of Opportunity, and it talks about how we spend a lot of effort on the early years, as we should, to reduce risk of children, to address adverse childhood events that occur in utero and up through about age 2 or 5. But adolescence is another period of intense growth and the need for appropriate supervision, appropriate scaffolding as our kids do start taking more chances and developing new kinds of relationships. Yeah.
That's a very hopeful message.
Yeah.
Can you give us some handle on the magnitude of the problem in terms of adolescence?
So in
Per
terms
se?
of the number of kids who engage in harmful sexual behaviors, we actually have fairly poor epidemiology around this. We're not very good about asking kids about inappropriate sexual behavior that they may commit. We ask them about risky sexual behavior with peers, and sometimes we ask them about sexual harassment and sexual victimization with peers. We never ask kids about sexual behavior with younger children. So there is very little information. There's one study that was done in the 80s that suggested that maybe something like 20% of adolescent boys had engaged in what would be defined as illegal or harmful sexual behavior with another child. But we don't have a very good sense of that.
But we know how many offenses have been.
Oh, yeah, we
Yeah.
absolutely know. I know the number for the, I could tell you 900,000 people right now are on sex offender registries. We don't know how many of them are on for things they did as children.
Sure.
About 265,000 people right now are incarcerated for a sex offense, and about 5,400 people are in civil commitment facilities. Pennsylvania runs a civil commitment facility that only commits people who committed their offenses as minors. I don't have any idea what they're thinking in that state, but the scope isn't especially well known, but we do know some figures that mix kid and adult numbers.
Sure.
Yeah.
Any other questions or comments? Yes, Shep.
Shep has a question? I don't believe it.
All right, you guys.
Wait, do I have a life course? I had a life course. I had that slide.
I saw it there. I was interested in the question of how, sitting here experiencing the talk, which I thought was really opening a whole arena that I had passed by without paying a lot of attention. And I think that's maybe due to the fact that in the prevention literature, the people that do prevention are used to thinking about, for males, certain kinds of aggression, acting out, and so forth. It's sort of seen as a general field of lack of socializing. And for females, people wonder what's the issue. For females, what do they do? Maybe they internalize, which we've also published on that. But in all the years, I'm 87 now, and I think about prevention research, and I think it's not growing to integrate the kind of things you're talking about. There's something about sexual behavior in children which doesn't get lumped in the same way among the researchers I'm talking about, maybe.
Yeah, I think we've done a much better job with pregnancy prevention and with concerns about STD. Unfortunately, what those tend to do is really emphasize the negative of sex, and we don't really do a good job of even talking about positive or healthy sexual development of kids. And we don't really have any history of addressing child sexual abuse as a preventable problem. I think for the reasons I said. I think, and we actually have some research, not we, but Berkeley Media Studies Group and the Framework Institutes, which are two social media kind of communications focused organizations. They've looked at what people believe about child abuse in general and about different types of child abuse. And people recognize that child physical abuse is preventable, and I think that maybe because most of us who are parents can at least can understand why you might hurt a child on occasion. But we can't make that same leap with sexually touching a child. And so The public very much views child sexual abuse as uniquely unpreventable. The grant that I very much hope NIH will fund is a communications grant to do a deep dive to figure out how we as experts and we as frontline practitioners can overcome that gap between what we know, it's preventable, and what the public and consequently policymakers believe, which is it's not, and the best we can do is just throw everything we can in the criminal justice side of it.
Well, just one thought additionally. I think we're not doing very well at understanding and naming sexual abuse in the whole arena of socialization of kids. How do we socialize, and to what extent is this so unique and so shocking that the scientists themselves have let it be isolated?
Yeah, I mean, my sincere hope is that one outcome of the Me Too movement is that we really do begin to talk more about consent and respect in relationships. But that means talking about sexual relationships with kids. And as a country, we much prefer to ignore the reality that children are sexual, and particularly we ignore it starting in 6th grade. That's up until 6th grade, we're happy to talk to kids about sex. And then after 6th grade, it's really a place that we let drop in the schools and maybe even in our own homes to some degree. So hopefully the movement may actually energize a little bit this area of science.
Well, I think we got to pursue it.
I'm right there with you.
She's trying.
Yeah,
Anybody's
I really
pursuing
am.
it.
Yeah.
Well, thank you very much, Elizabeth. I thought it was a fantastic talk, and your presentation was, as was said, it was gripping. Thanks. And I think you've opened our eyes to a different dimension of child sexual abuse, which I think is critically important. And we're so proud to have you on our faculty and part of the Johns Hopkins Bloomberg School of Public Health as a professor. And keep up the good work. And you've heard the orders from Shep. You know, you got to keep doing something. And
Yeah.
So please, everybody. Yep.
Thank you. Thanks. Thank you.